Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again and live your life to the fullest. I'm so excited about today's show because I have back on our podcast Dr. Mark Burhenne. Let me tell you a little bit about him. Dr. Burhenne is the creator and author of AskTheDentist.com and the best-selling author of the 8-Hour Sleep Paradox. He's a family and sleep medicine dentist, member of the American Academy of General Dentistry and the American Academy of Dental Sleep Medicine. Dr. Burhenne, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
Carrie, thanks for having me back on the show. I'm very excited.
So, Mark, it's been about a year since we spoke last. I remember on our last interview, you had actually just come out with your best-selling book, The 8-Hour Sleep Paradox, and we were talking all about sleep apnea and snoring and the importance of having adults tested, but also children.
Yes, and I'm very excited about that because there have been a lot of developments in that area. It's a very complicated topic, but it's a very important topic because if we weren't adults that had small airways because we developed improperly or poorly, we wouldn't have needed to have that conversation. Why not catch it early? Why not catch it in our formative years?
So in today's podcast, I wanted to really focus more on children because I don't think there's much information out there, for parents to understand about children and how they sleep and if they're snoring and that they should be checked for apnea. So I know that you're the expert that's going to help all of us understand this topic a little bit more, better. So why should parents be concerned about their children's sleep and especially like the development of their skull and their facial bones and their palate?
Right. It's really you're right. It isn't discussed often enough, although that is changing. We're looking at it differently. There's something called the sleep breathing paradigm that phrase was coined, or that concept was brought to everyone by Dr. Park, an ENT on the East Coast, and that essentially states, and I am completely 100% behind it, that we are all susceptible to breathing issues at night, especially, that we all have compromised breathing, and we all have the potential for some kind of interruption due to a collapsing airway. And the question is okay, we've talked about the adults. We know about obstructive sleep apnea, sleep disorder breathing. We know that, if you're an overweight 60-year-old male that weighs 300 pounds with a big neck size, that, we snore and we have sleep apnea. But what we don't know is that you can be, a healthy, premenopausal, petite, low BMI woman and have obstructive sleep apnea or UARS. And then take it one step further, you can be a 1-year-old, you can be a 7-year-old, you can be suffering, you can be a teenager, and no one really will know, that you are not sleeping well because your airway is collapsing. So it's kind of been working backwards, which I guess we do a lot in healthcare. And in a way, you could say that we're really working towards the large, comprehensive root cause, and that is how we develop. How do we get into this sleep breathing paradigm? How do we get to the point where a lot of us, 30% of us, perhaps more, are suffering because we can't sleep properly, because we can't breathe properly? And what is the root cause of that? Well, it's our development. It starts early on, perhaps even, prenatally. I mean, and we can talk about that. We can talk about prenatal perinatal and postnatal considerations in terms of development. And the irony, for me, at least as a dentist, is that this has been kind of in my backyard all along. I mean, dentists are trained in dental school, and this is our realm. We're responsible for facial development. We study it in school. We look at side views of the skull. We measure, the gonian angle, how tall the ramus gets. These are all anatomical features of the jaw and the mandible and the skull and the base of the skull. And then we even get some anthropology in dental school, which I always found fascinating. But it's almost full circle now where I'm realizing how important this is, as are a lot of dentists and ENTs and physicians. So again, you could kind of call this, refer to this as a root cause that we are now finally beginning to work on, and that is looking at our children for and trying to screen early for problems that could lead to sleep apnea or UARS later in life.
So from the aspect of the parent, what should they be looking for with their baby, with their child, when it comes to maybe signs or symptoms that might lead them down the track to consult a specialist?
Right. So there are a lot of things that are pretty simple to look for. I mean, you just have to know what they are. And one thing that I like to look for or to talk to parents about, because it's a pretty simple thing that you can kind of send them home with homework and what to look for. I ask parents to go in and, after their child has been asleep for an hour, half hour, and perhaps before the parent goes to bed, is to go in and look at their child sleeping. Most parents do this anyway, just to make sure their child's fine. But to look at the lip posture, or whether their lips are parted, open, or whether they're closed. In other words, what I want them to look for and to differentiate, is their child a nose breather or are they a mouth breather? And mouth breathing has a lot of consequences. It tells us a lot. It tells us that the child already has developed into a kind of into that paradigm where they're not going to develop correctly because they're bringing in the air incorrectly. They can't breathe through their nose. The tongue position may be off. If the tongue position is off, then the jaw won't widen properly. In dentistry, we talk about how the muscles grow the bones of the face. It's not the other way around. It's not the face that grows and then the muscles and tendons all fill in. It's the muscles that grow the bones. Man is the only primate that can get impacted third molars. Why is that? Because our jaws don't form properly. We're not breathing properly. If your child is mouth breathing, that is a really quick way of knowing that you've got to get help. And I would recommend this at age 1, 2, or 3. My referrals now to ENTs, even orthodontists, and this I think will surprise a lot of people, start at age 5. Most people think they need to get an orthodontic referral, maybe age 8 or 9 for phase 1 treatment, or, in the old days it was age 12 to 13, wait till all the teeth are in and then just move the teeth. Well, what if the jaw hasn't formed properly? You're not going to be able to move the teeth properly because the jaw won't allow it. So that's one easy thing to look for, but there are other things too. There's the child's behavior. Are they edgy? Do they get angry? Do they fall asleep really quickly? Do they have cravings for, crazy cravings for carbohydrates? Candy is a big one. I see this happen all the time. The kids that have sleep disorder breathing issues where they're not sleeping well, they need sugar. That's a natural thing to look for because the body is craving energy. It's tired. We all know that obstructive sleep apnea is a precursor or predilects to insulin resistance. Well, that's where it starts. Your blood sugar levels are all over the place. If you're not getting, deep sleep, delta wave sleep, growth hormone release when you're in deep sleep. So those are a few things. You can also, bedwetting is perhaps a sign. Snoring. Kids can snore. If your kid is snoring, that's not a normal thing. For me as a healthcare practitioner, that's an automatic referral to a pediatric ENT. It's not normal. It's not cute either. A lot of parents think it's cute. They'll even come in with a videotape a little off their smartphone of a recording, a videotape of their kids snoring that they've shared with family. Look, little Jennifer is snoring. Isn't it adorable? And it's not. It's a sign that they can't get enough air past their airway, and they're probably mouth breathing if they're snoring. Throwing the sheets around, ending up 180 degrees in bed, that's throwing the sheets off. That's typically like a night sweat thing. That's related to sleep apnea. Grinding, bruxism. That's a great dental thing that parents can pick up on. You see the teeth are worn. Most parents can hear their child grinding or bruxing, and for me that is an indicator, along with other things, kind of this cluster of things, that the child is suffering. They are trying to open their airway by involuntarily moving their mandible around as if they're choking. So those are some of the signs. There's more, but I think what they need to do is, I think every child needs to be, and I've talked about this in my first book, and I'll talk about it again in another book on facial development, and that is that every child should have their sleep verified. Every person should have their sleep verified. It's a foundation, it's a pillar of health, along with the gut microbiome, and then diet and exercise. It is, if you don't have that, nothing else, everything else will fall apart. It won't work. You can diet and exercise, but if you're not sleeping properly, you're spinning your wheels. So
yeah, that's what I was just thinking. Yeah, you can diet, you can have the right diet, the right exercise. You can be taking handfuls of supplements. None of it's going to work if you're not sleeping well.
Exactly.
And I remember from our first interview together, and by the way, for the listeners out there, I'll find that interview and I'll put the link for that in the podcast notes so that you can listen to that interview too, because that was really informative. So I remember in our last interview when we were talking about adults, you had said snoring is never normal. Never. It should always be checked out. It's very common, but it's never normal.
Right. And here's the second part to that. If you don't snore, that doesn't mean that everything is okay. Your airway could constrict so much that you can't snore. In other words, snoring is a partial collapse of the airway. The airway is touching, but you're able to get air through it. Think of an oboe reed. That's how the oboe reed makes noise. It's two pieces of reed material that are squeezed together, but you're getting the air past it and it vibrates. And a lot of people, I know, I have a lot of patients, mostly men in their 40s, that don't snore, but then when we get the sleep study, we realize that they're just having long apneas, and they're going from apnea to apnea, and they can't snore because their airway is so occluded. So that's just, I'm just saying, snoring, absolutely.
And then going back to what you were saying about behavior in kids, explaining about the sugar cravings and the need for energy, that makes complete sense. And we know that lack of sleep can have long-term consequences. So I wanted to ask you, because I get a lot of questions from parents about treating ADD, ADHD. If a child has issues with ADD or ADHD, focus, concentration, would you also consider that under that kind of topic of behavior as being a possible sign or symptom of a breathing issue? Yes.
Absolutely. The problem is that most parents and teachers pick up ADD, ADHD later. And what I'm worried about there is, in hindsight, perhaps you can say, oh, yeah, I did see the early signs of ADHD, but it gets picked up usually by age 8, 9, 10, 11. And in some cases, that's too late, because if you want to, take out tonsils, adenoids, do an early orthodontic referral to widen the arches, and get the patient to breathe better with skeletal changes, starting at 9 or 10 or 11 or 14, it's too late. There's very little you can do because most of the development is done. So, but you're right. I think I just saw a tweet the other day. It could have, I forget, but it was a great tweet. It was basically saying that ADHD is a sign. It was the reverse of what we normally see. It was that ADHD is a sign that there is OSA. There is an obstruction of the airway. So it's in the literature, and I'm still surprised when I make referrals to the appropriate, healthcare professionals, that I get a lot of pushback, like, oh, come on, just because this patient snores, has big tonsils, is a mouth breather, and has ADHD, there's really no reason to have concern or to get the sleep study. And that's what, that's the frustrating part. That's why I wrote the first book. I felt like I was standing on the sidelines with all this information, trying to help my patients, and then when it went to the primary care physician, it would get kicked back. And that's why, I have to write about facial development. I mean, that message needs to get out there. But of course, when it gets to the layperson via the web and books, and it's gonna take off.
I share some of those similar frustrations working with other health providers, that sometimes the solution can be relatively simple or easy, from the outside, and it can be just brushed off, which is too bad. So, okay, so going back, you were saying for parents to check for, is the child a nose breather or a mouth breather while they're sleeping? Watch their behavior. Are they a bedwetter? Do they snore or not? Do they grind? Are they all wrapped up in their sheets at night? And so if a parent is seeing this in their child, then what's the next step for them?
It's a great question, and again, that's where the frustration occurred for me. Unfortunately, we do have now a great solution. It's a company called Knit Health. I am one of the medical advisors for it. We finally have a product. Let me back up a little bit. So the frustration was we would send to a primary care physician or a pediatric referral to a pediatric physician, and a lot of the time, it would just say, let's just wait and see how the child develops. They'll grow out of their adenoid face or their swollen adenoids and tonsils, and to me that's very frustrating, because every minute counts. Every night they mouth breathe, they are affecting their development of their face and lower face and airway. So, but now, so the intent there was to get a sleep study, to get the child into a sleep study. A sleep study, the PSG, the polysomnography, is very inconvenient for a child. They have to sleep in someone else's bed in a hospital or a clinic. The parent has to be there. They have all these things glued to their face. It's a very foreign environment to them. They may not have all their stuffed animals there and the security of all that. That is a problem, even if they do get the sleep study. And that's why we developed this product where they send you something in the mail. It's a camera, and for 21 days there's a 21-day assessment of your child's sleep, and it is a comprehensive, as good if not better than a PSG, and nothing is attached to the child's face. They're sleeping in their own bed. Everything, in fact, they don't even need to know that the camera's there. It's a tiny little camera that gets Velcroed anywhere above the child. And then you get the assessment, it gets sent back to you. I recommend having that done every year until the child is maybe 15 years old. Anyway, it's wonderful technology. It's going to be adapted to adults soon. I think
that was my next question.
Yeah. I mean, the days of the PSG, I think, are numbered. It's a cumbersome, expensive test that it's this little threshold that is hard to get past to get that diagnosis. And considering how many people, probably 50% of women before menopause, healthy women, have some kind of sleep disorder breathing. How do we pick that up? Those are RERAs. That's called UARS. The PSG usually doesn't pick it up. It can. Our test does. This little camera actually does pick that up as well. So it's nice to know what your child is doing all night long. To get a 21-day assessment for $200, which is less than a co-payment for a PSG, is absolutely amazing. That's what I recommend. I mean, I finally have something that I can fall back on. Before it was almost to the point where I hated bringing up the fact that, your child has some issues, or your child. It's happened yesterday. 2 children came in, a 3-year-old and a 9-year-old. And the 9-year-old we had been working with, and we actually recommended mouth taping, and the parent took it to heart, and the 9-year-old came in and was so excited. Of course, he was in better shape than we saw him last time, and he told me that he loves mouth taping and that his dreams aren't scary anymore. I mean, I don't know how important that is, but obviously he has a better sense of how he is sleeping. The 3-year-old, of course, is coming online and shows signs of a small airway, mouth breathing, irritable, chapped lips. A lower chapped lip as opposed to no upper chapped lip is a great indication that the child is tugging on their lower lip to pull down their nose to help them breathe through their nose. I read that a few months ago, and I've been seeing that, and there certainly is a correlation there. I always thought it was just wintertime stuff or a habit that the child had, but it's really the body trying to open up the nostrils to get in more air. It's fascinating. So anyway, so my point was that I didn't want to, I felt the dread of bringing up, because I knew it would be a long conversation. I would have to explain to the parents, what is going on, and the dread was, but I have no solution. I'm going to send you to a primary care physician, and it's going to end there. It's going to stop, and nothing will happen. And to me, that was very frustrating. Finally, we have something where we can just refer them to this test. They get the report, and the referral is made to the appropriate referral at that point. And they send you a 20-page glossy report, 21 days of what is your child doing, what are the implications, what's the quality of their sleep, the quantity, what could be the issues. It's a wonderful tool for helping verify our sleep, and it will be adapted to adults soon.
That's very exciting. As a doctor who does recommend patients go for sleep studies, and I totally understand the pushback for adults. I mean, it's got to be so hard for kids. So this is very exciting. So thank you for bringing that, to the public. Going back to facial development, what are some of the things that cause or influence facial development? Is it just like genetics? And you were talking about prenatal and perinatal and postnatal.
Right. So essentially, speech and language, our ability to speak. If you look back in the evolution of the primates, speech and language came at a cost of breathing. We can speak, but we can also choke, and we're the only primate that can choke. And why did that happen? How could evolution allow that to happen? Well, nothing's perfect, and of course we're still here, but we're able to communicate. We're evidently a very sophisticated species, but we have problems sleeping because we have that ability to speak. So what happened is, if you look at the changes, from Neanderthal to from Cro-Magnon to our current state, a lot of things happened in terms of positioning, especially in the airway. The tongue so the voice box, the relationship of the voice box, the larynx, the tongue, and then the curve in our tube, in our airway, because we're upright beings, all of that changed over the years. Even the little hole, it's called the foramen, where the spinal cord attaches to the base of the skull, that has moved forward over time. The shape of the nose, how the nasal cavity sits over the palate has changed. The position of the tongue in relationship to the epiglottis and the voice box, the vocal cords, has changed. Everything's kind of tightened up and gotten very close to themselves, and because of that, our airway has been compromised. And again, that's that sleep breathing paradigm that Dr. Park talks about. We are all susceptible to breathing issues because of how we evolved. And then, so that's genetics. And then there's the epigenetics of it. When we come out of the womb, what things can affect us adversely in terms of development. Again, we're not our final product until we're fully developed, maybe at age 12 or 15. And so what things can affect that? Well, here's a list. It's the modern diet, it's soft food as opposed to chewing hard foods, it's bottle feeding as opposed to breastfeeding. I can expand on these things later if you want. The soft diet I talked about, thumb sucking, pacifiers, nasal congestion, which would be allergies. There are a lot of things in our environment, a lot of foods that make us almost from the day we come out of the womb allergic, and we become mouth breathers because our noses are congested. Have you ever noticed how and I've always kind of thought this, and now we're finally getting an explanation. All our kids need braces. If you look at adults that, in the archaeological records, I mean, from even 2,000 years ago or 4,000 years ago, they didn't. There was no crowding. There were no caries. There was no cavities, of course. But what's changed since then? Well, we're not breastfeeding as much. It's difficult to do that in our society, unfortunately. We have a lot of allergens. We've created a lot of foods and products that do congest us, and if we're breathing through our mouth and we're not swallowing properly, again, it's the muscles, the action of swallowing, the action of sucking on, mother's breast, because that's hard. I mean, that takes a lot of work. That sucking motion actually helps the jaw and the airway and the skull, the bones around the airway, the structure for all this stuff gets attached to, it helps develop it in a certain way. We are developing with smaller lower faces, steeper angle jaws, lower jaws, smaller airways certainly, narrower arches where the tongue gets pushed back. There's no room for our tongue. We're seeing a lot more tongue tie. It's really frightening to see, and we could turn it around. I mean, if we wanted to, in the next generation. I mean, in our current generation, it is an epigenetic thing that if we can just change the external factors, not use sippy cups, breastfeed longer, if possible, those kind of things, then this can all be dealt with properly, and we won't grow up into adults that have issues that impact us, that kind of affect the quality of our lives, especially in our latter years with systemic diseases.
So one of the things that you said was about the vast majority of kids now need orthodontics, and so one of my questions for you is, do orthodontics fix this problem?
Well, it can. It depends on which orthodontist you see. Now, if you just see an orthodontist that wants to straighten the teeth, no, it doesn't fix it. You could have a narrow, high-vaulted arch with a narrow arch width. For example, if you can visualize the distance between your upper left second molar and your upper right second molar, there's a distance there. That needs to be wide. Our faces need to be wide. They can't be long and narrow. Long and narrow. Just think, if you have a long and narrow face, you have a long and narrow airway. Everything gets pinched. So that pterygoid width, those are that bone up there that holds the second molar, upper second molar. It's the pterygoid process. If that has proper width, then think about all the bones and the holes in the bone nearby. That would affect the height of the vault of the palate, because it's right next to it. It would pull it down a little bit like a curtain. There's a posterior nasal aperture there. Those two little holes where we get our postnasal drip, where the nose drops through into the airway, those widen if your molars are far enough apart. What else happens? The length of the forward to backwards length of the jaw is good. Your wisdom teeth come in. There's enough room for them. I mean, so that's just one measurement. There are hundreds of other measurements that if they're off, it's going to affect your airway. So, yeah, I mean, everyone's getting braces. I see very few, maybe 2 to 5% that don't need braces. There's something wrong with that. That's not how we were 4,000 years ago.
So Mark,
and we weren't removing wisdom teeth. We weren't doing that.
Yeah. So Mark, I want to ask you a really dumb question here.
No, please.
Do all dentists know about this, or is it just you that you're that specialized? Like, I know right now, parents that are listening are seeing these things in their children. They want to know who's the right person to bring their child to see, to get them assessed. No,
that's a good question. I'm almost afraid to answer it. I mean, there are a lot of dentists that know this. I mean, again, when I talked earlier about my dental school, which was 30 years ago, we did talk about this. I think some of it gets forgotten. As healthcare practitioners, we get into ruts. We follow, we bill for, based on codes and procedures, and that happens to every healthcare practitioner. I think the information's out there. I would say it will happen often where you'll take the information as a listener today that you heard here. You'll go to your dentist and you may get a blank look. I mean, that could happen. It's likely that will happen. And I think that's a good thing, because then maybe you need to see another dentist. I'm very cautious on orthodontic referrals now. And I wish I had known this when my kids were getting ortho. I would say they're only, in my area, again, I'm in the Silicon Valley, millions of people, a lot of orthodontists. There are only 3 within a 50-mile radius that would treat the patient in the way that I would want them to be treated, and would even accept a referral at age 5. That's an early referral, but that's when you want to get going. I mean, expansion, there's a technique in orthodontics that is finally finding favor again, and that is rapid maxillary expansion. Is if the child was a mouth breather, a thumb sucker, has a very narrow vaulted arch, that distance between the second molars is narrow, we can widen that. We can widen that very quickly in a matter of months with just by gluing an appliance and getting that width back. And by getting that width back, there are a lot of other things that follow. So, assuming that the nose breathing is addressed and all of that as well. So, yeah, it's difficult. A lot of this information is new, although it's been around for a while as well. But you know how that works, right? Information kind of disappears, and it comes back up. We add something new to it. So it may be difficult for people. Not every dentist is going to give you this information, unfortunately.
And can you talk about your upcoming book?
So we talked about that last time, and again, it's being written out of frustration, standing on the sidelines, not seeing children being referred to the right people, and it's in process. We've again, with my daughter and I write these books, and we're thinking maybe, because it's such a, we pulled the chapter, this book is coming from the chapter that we pulled out of the 8-Hour Paradox, because it was so complicated and so long, and it kind of just threw off the first book, because it was just like a big anchor. And we wanted to develop it more. So we've been working on it, and again, there's been a lot of new information. And what we thought we would do, instead of writing a book, and again, we haven't decided on this completely yet, but we thought of maybe doing an online seminar and guiding people through it. Because conceptually, even for me, even for dentists, it's difficult. It's a tough nut to crack. There's so much going on. It has to really, there's a flow to it, and if this, then this, and then you got to do this, and then you have to wait 2 years and wait till the ortho kicks in and to see, and then you have to verify it. You're going to have to do that NIT health exam, and maybe every 6 months, every 2 years. I see parents struggle with this, and I go through the struggle with them, and it is complicated. So it really needs perhaps a different format, and we're working on that. It would be like a weekly thing and a checkoff list, and maybe a big flow chart, that kind of thing. So it's in process. We're very excited about it. The working title was Sleepyhead. I don't know if we'll stick with that, but it's important. I mean, we have to make sure our children reach their full genetic potential. And it's not happening. And if you use crowding teeth, no room for wisdom teeth as a litmus paper, well, that's 98% of the population right there that is not developing correctly. So if you want to correlate that to perhaps airway involvement and I mean, it gets scary if you look at those numbers. So yeah, we're evolving. I'm not sure we're evolving in the right direction.
So can you go back to the 21-day sleep assessment? Where can listeners find out information about that for their children,
absolutely.
and then the upcoming for the adult version?
Right, yeah. So right now it's just the under age 18. It's nithealth.com/Burhenne. So that's KNIT health.com/Burhenne. That gets you a discount if you go to that website. I just get goosebumps when I think about it. I mean, it's finally something. It's something that I've been either subconsciously and consciously been needing and looking for probably for the last 6-7 years. And I hope it does well. I think insurance eventually will catch on and just cover this. I mean, it's something that we need. There are other countries like Iceland, Italy. A lot of these countries are screening routinely their children for sleep. Why aren't we doing that? I mean, supposedly we have a great healthcare system. I think it's terrible. We wait till the comorbidities show up, like diabetes, heart disease, and we put stents in. We love doing that, and we're good at it. But why not prevent that to begin with? How about mental mood disorders, depression? Let's get that. Let's look at the root cause of it. If it's sleep, ADHD, why are we giving Ritalin when we can perhaps eliminate that altogether? Again, it's a flawed system. So if we have the right test, it's inexpensive, we get past the politics and the cost of it, then this could solve a lot. So for $200, you get this great test, and then I think there's a recall system for $14.99 a month where you can get tested anytime you want. It's a bargain.
And then, Dr. Burhenne, how can our listeners find out more about you, and where can they get a copy of your book, The 8-Hour Sleep Paradox?
Well, that's easy. Amazon.com, just type in Burhenne, you'll see it. You can get a Kindle version, paperback version shipped to you. You can go to our website, askthedentist.com. We have a great, speaking of recently of what we just spoke about, we have a great guest writer that wrote an article on tongue tie, which is something that should be looked at. Sarah Hornsby wrote that article. She's a myofunctional therapist that I referred to via Skype. My patients Skype with her. She's up in Seattle, and they get myofunctional advice on how to swallow. If you are tongue-tied, that if you simply said, if your child is tongue-tied, if their tongue cannot move around properly, again, the muscles can't grow the bones. That tongue will not move properly, hence the jaw will not form properly, hence the airway will be impacted later on in life. So there's a great, I think it's our most recent blog post on that, on tongue tie. So askthedentist.com would be a great resource, not only for dental, but also for sleep and development.
Fantastic. So for our listeners out there, I'll make sure to find all of those links and have them in the podcast notes so that you can easily find Dr. Burhenne and all of the great information he has to offer. Dr. Burhenne, thank you so much for being my special guest today. This is, again, another awesome interview.
Thank you, Carrie. Pleasure to be here.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Dr. Mark Burhenne. And I want to thank you, our listeners, for tuning in today. And I'd like to invite you back next time for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.